My name is Dr. Grigory Goldberg. I'm part of the Seaview Orthopedics, and I do spine surgery, and specifically I specialize in minimally invasive spine surgery. I wanted to discuss today the topic of disc replacement because spine surgery has been around for a long time, and a lot of patients have heard bad stories about spine surgery. Specifically, they're afraid of fusion, where a disc is taken out and a spacer is put in and a plate is put in. The technology has advanced. There is a new technology available right now, and the new technology is disc replacement that allows to help the patient to take the pressure off the nerve, to free up the nerve, so to speak, but instead of fusing this disc space, instead of putting a spacer there, we put a disc replacement there now, which allows for the patient to continue having normal range of motion and not to have any problems with any other discs for the rest of their life. Disc replacement surgery is basically done for any disc condition, especially in the neck. And what happens, and I'm going to show the model here, this is actually a model of the lower back, but it would also help with the neck as well. The disc displaces and pushes on the nerve. And we try to do conservative treatment first. We always try to do therapy first, injection first. When everything fails, that's when the surgery is done. And a lot of times, surgery requires taking the disc out to open up the space for the nerve. Well, if you take the disc out, you have to put something back in. And then in old days, that used to be fusion, where we put like a special spacer in and a special plate to hold everything together. Nowadays, we can treat the same issues for the disc herniation when the disc is pushing the nerve, but when we take the disc out, instead of putting a spacer in and putting a plate in with screws, we do a disc replacement. And what it allows, when you do a fusion, then this disc would never move again. When you do a disc replacement, it allows for the spine to continue movement like a normal spine. Same way people would have a hip replacement or a knee replacement. The disc is made of two components. There's a plastic and there's a titanium. And you bring them together, and together they allow for the movement between the two bones and for the patient to have a resolution of the symptoms. A good candidate for disc replacement surgery would be somebody who has an issue with their neck, who has failed conservative treatment, who has a disc herniation, preferably young. Because anybody who gets to age 60 and 70, and if they still need the surgery, there might be too much arthritis in the neck for the disc replacement to be effective. But somebody who is in late 50s, 40s, 30s, and has an issue that has not been resolved with the injections and therapy, are excellent candidate for the disc replacement surgery. It's preferable in most patients. Again, the spinal fusion, even though it's a very good procedure, it limits the range of motion after the surgery. And potentially another problem with spinal fusion, if a disc is fused, then whatever motion used to go through that disc now will be transferred to the other discs, and they can potentially deteriorate faster. If you do a disc replacement, that motion continues to be there, so the disc continues to move like a normal disc. So as a result, in long term, there is no effect on other discs, and patients do not lose a range of motion and just resume normal life. It's a very successful surgery. The patients get resolution of the arm pain, almost completely gone. The neck pain is completely gone. Again, the range of motion is restored. And because it's done minimally invasive, people can go back to doing their normal activities much faster. The procedure itself, the surgical part, usually takes approximately an hour. It depends. If it's just one disc, it's an hour. If it's more than one disc, sometimes it takes an hour and a half. Patients sometimes stay overnight in the hospital, sometimes go home same day. Then we send them for physical therapy for approximately 4 weeks. So altogether, between 4 to 6 weeks after surgery, as patients are walking around, doing activities, doing physical therapy, they're recovering from the surgery. And once they're recovered, they can resume normal lives.